So we're just coming back from ASCO and really digesting and taking in some of the things we heard and experienced and felt this year. So starting off, I wanted to share one of the key things that we're hearing from a data perspective. Of course, there were several breakthrough therapies, several, large plenary sessions that have a lot of impact on practice. But one of the things I also really appreciated was that in the plenary discussants, as well as other discussant sections, we're hearing more and more about the patient experience. In addition to the practical application of the data, we're hearing about really the question of, is this what a patient is going to want and what the conversation could look like to get them on a therapy? So I think that just emerged as a key theme. And it's something that we're also seeing kind of this human experience bleed into maybe some of the approaches for booth work as well. So I know, Nicole, you saw a similar trend, if you want to talk to that as well.
Exhibit fall, that theme really resonated with a lot of the companies in the exhibits. Of course, pipeline, portfolio, scientific presence, the data was really elevated, but patient centricity and the patient experience and was one of the key priorities as well on the exhibit floor. And it was really nice to see companies carving out a space, a dedicated space for HCPs and industry peers to have those discussions and to offer resources for HCPs to be sharing with their patients to navigate that patient experience and really, again, mirror what you're seeing in those presentations and taking it out to the exhibit hall. So, and of course, there's a lot of new technology being used in the exhibit hall too. Every Congress yields something new. A lot of interactivity, but one of the things to keep in mind, and we're keeping in mind as we go, is what's the smart use of interactivity and technology. We want to make sure we're getting those messages out quick and priority messages out quick, and redundancy is okay at an exhibit when you're trying to catch people's attention and give them the most important information that they need to know to spark those conversations, like about the patient experience. So one of those things, those trends that we have seen is AI and it being used in a mindful way. So I know, Kathryn, you wanted to talk through a couple of things that you had seen on the show floor.
Yeah, so, I think we're seeing AI being applied more and more. And one of our big questions has always been how to responsibly apply this. And so I think we saw a few good applications with Geo, as well as some patient avatars that I saw on the booth floor just that were being tested. And what's nice is these really provide an opportunity for HCPs to discuss and really model the conversation with their patient and gives it that patient base that I know is so important. So I felt they were very good applications of this with a specific purpose. And that's something that we try to focus on as we think about applying these technologies, is not just the amplification of your message, but the purposeful use of how you do these things. So it was a nice kind of pull through of everything that we were seeing. I'm excited to see where that area goes as we go to more and more of these conferences, because I think we're just at the beginning of that phase of applying kind of this technology to thinking about now the human experience. So it was busy, but it was a great ASCO.